agreed with the NWFP government and the humanitarian community in July 2009. I will turn now to the projected funding requirements for 2010. As you can see, the overall requirements, as I mentioned, are 537 million for the next 6 months. As a large part of the vulnerable and affected population will still be dependent on continued food assistance, by far the largest portion of the request of 195 million will be required for food-related projects. Activities addressing shelter and non-food items are the next largest component at $80 million. Activities for health require 73 million. The key activities for 2010 include effective coordination and timely service delivery and protection in IDP camps, setting up new campsites as necessary in accordance with the SPHERE standards, and planning and implementing the closing and decommissioning of campsites using the agreed procedures, as well as strengthening the capacity of government counterparts. The area of community restoration, which was previously called early recovery, has been renamed this year to better reflect the focus of this thematic area. After all, early recovery is a cross-cutting strategy that is being implemented by all the clusters. But the early recovery activities that do not fall within any of the other clusters are coming under the area of community restoration. The main activities for 2010 for community restoration include the restoration of non-agricultural livelihoods, strengthening governance, social cohesion, community infrastructure, and environmental services. Coordination is an important part of this large enterprise of humanitarian response in Pakistan, and the main activities for 2010 include the improvement of emergency preparedness and coordination, resource mobilization, and strengthening of interagency coordination, humanitarian access, and strategic planning, monitoring, and reporting systems. Education has an important role to play in populations identified as the most food insecure. In the area of health, the key activities for 2010 include the rehabilitation of the primary healthcare services network, populations identified as the most food insecure. In the area of health, the key activities for 2010 include the rehabilitation of the primary healthcare services network, delivery at all levels, especially of the non-functional health facilities. Logistics is a key component, and the key activities are coordination of the management of humanitarian logistics hubs and distribution points in the areas of displacement and return. Nutrition activities for 2010 include the provision of nutritional support and treatment for malnourished children and the promotion of optimal infant and young child feeding practices. In the area of protection, the key activities for 2010 include the provision of unhindered access to humanitarian assistance, particularly by vulnerable groups, contribution to protection of the displaced population from violence and abuse, particularly women and children, and strengthening the protection capacity of the relevant authorities, institutions, and civil society. Shelter and non-food items is the second largest area of action, and the provision of household non-food items to the affected population, including adequate living space according to the SPHERE standards, and the capacity building of local communities in early recovery and natural disaster response will be key activities in 2010. The final thematic area is water sanitation and hygiene, where the key activities in 2010 include ensuring access and provision of safe drinking water, appropriate sanitation, and promotion of safe hygiene practices to IDPs in camps and host communities, as well as returnees. Madam Minister, Excellencies, ladies and gentlemen, activities are ongoing side by side, making the challenge great for the national and international community. So, on behalf of the humanitarian community, and in the name of the Secretary General of the United Nations, I launched the Pakistan Humanitarian Response Plan for 2010. I thank you for your attention.
Thank you, Martin, for this official launch of the appeal.
Nadeem, honorable delegates, excellencies, ladies and gentlemen. Let me at the very outset first of all acknowledge the NWFP government, the SST group, the Special Support Group, the UN Humanitarian Coordinator, and all the humanitarian workers from around Pakistan and around the world who are working and have already worked tirelessly under difficult and often very dangerous circumstances to assist the people of Pakistan who have been displaced and in some cases to also save lives. I would also like to thank the donor community and development partners on behalf of the people of Pakistan. They have responded generously and efficiently during our partners has been instrumental in preventing dire outcomes by providing shelter, protection, and critical medical attention to hundreds and thousands of people. Excellencies, ladies and gentlemen, Pakistan is indeed a frontline state in this war against terrorism. Our resolve to eradicate this menace is unwavering. We are aware that peace and development are interdependent. Without peace, there can be no sustainable development, and without development, peace will always remain elusive. Therefore, our focus on conflict management has shifted from peacekeeping to post-conflict reconstruction for peace building. This involves managing the transition from conflict towards sustainable peace through development. To win this war, we have to win the hearts and minds of the people, and the need to take urgent concrete steps for rehabilitation of the internally displaced persons is of critical importance to achieve our goal. This is the only way forward to wipe out once and for all the plague of extremism from this area. Ladies and gentlemen, no other country has suffered as much as Pakistan in the war against terror. In addition to the innumerable sacrifices of our people and the armed forces, estimates put our losses, our economic losses that is, to around US $34.5 billion as a consequence of the direct and indirect impact of this war. Additionally, the present deployment of about 117,000 troops and establishment of 1,000 checkposts along the border with Afghanistan is further straining our resources. The loss of life and property has indeed been tragic. Pakistan's internal displacement crisis has now entered a new phase in two respects. Firstly, as the military retakes territory from militants, people are returning to their home districts in large numbers. Well over 80% of displaced persons have returned home to the Bajor and Mohmand agencies, Swat, Shangla, Puner, and Dil. With the assistance of humanitarian organizations, essential supplies have been made available to the returnees. The government of NWFP has distributed already about 380,000 debit cards to eligible families for cash payment of ₹25,000 per family. However, the magnitude of the IDP's crisis requires additional resources to meet the humanitarian challenge. Excellencies, ladies and gentlemen, a second development being witnessed is the displacement of approximately 200,000 people from South Waziristan and neighboring areas of FATA, that are Kurum, Orakzai, and Banu. Although the international humanitarian organization, of course, are assisting the government, both the federal government and the NWFP government, which is on the ground, and are making efforts for provision of supplies to these areas, but full access to the deserving people will remain a continuing challenge, as we have seen before. These regions are rather remote and more hostile, and the relief efforts will require a different supply chain than that which was established for the Swat and Malakand region. Ladies and gentlemen, the government of Pakistan is committed to work with the humanitarian organizations to respond rapidly and effectively to the current crisis. Let me close by identifying the main challenges that will be faced by the ongoing humanitarian effort as we see it coming. First of all, the Humanitarian Response Plan 2010 is yet to be funded. Donor governments are requested for their generous support as they were generous in the previous plan also, and as the return of displaced persons in substantial numbers